everyone. Thanks for your patience. I'm going to introduce the next speaker. It's Jean Rio. She's with the New York State Department of Health, a public health representative and training coordinator for NICES. She's responsible for working for the vendor training staff to develop and execute a comprehensive statewide training plan to ensure that all healthcare providers requiring training receive such in a timely and professional manner. Involves coordination of scheduling and registration for all training sessions, oversees development and modification of training curricula, and evaluates the effectiveness of trainings. We are especially grateful that she's here because we had an original speaker who took another position. So yay to her for helping us out here. And I'm sure you probably have a lot of questions, so we'll look forward to her presentation and then any of your questions. Thanks so much.
Thank you. Yes, I think it was mentioned at the beginning, Laura Santilli, who was our program manager, was the original speaker, but about a month and a half ago, she left us to move on to another program, so I am going to fill in for her. So first, I just want to kind of get a sense for the audience. If anyone, you could raise your hand to let me know, are you familiar with NICES? Is anyone familiar with NICES? Okay, pretty much everyone's familiar. Does anyone actually use NICES in their? Okay, good. So y'all know what I'm talking about. So let's do provider participation just to give you an update. So as of July 1st, there are 14.1 million patients, 52.5 million immunizations, and 1.4 million blood tests currently in NICES. We have over 12,300 individual users actually using NICES, and over 3,300 healthcare provider practices that are active. Over 1,100 pharmacies, 21 health plans, and over 2,400 schools that have read-only access. We have been tracking since the beginning of NICES the percentage of children less than 6 with 2 or more IMS in the registry. So that percentage is at 87.7. I'll show you the bar graph there. This percentage came out of the, it was the Healthy Persons 2010 goal, which was to achieve 95%. So we used that as our measure from the beginning of NICES in 2008. So you can see in the beginning of NICES, we're at 21.2, so we have grown a lot. We didn't meet the 95% as a state, but we still continue to grow. And I'll show you from a regional perspective. You can see most of our upstate regions have met that goal. So the Capital District, Central New York, and Buffalo are all over 95%. Finger Lakes is very close. And then you can see the lower Hudson Valley and Long Island are in the 70% range, which is actually very good because they did not have any prior registry history. Many of our upstate regions were involved with regional registries before the web-based system. So to come from 0 to 74% is still a great accomplishment for our lower Hudson Valley and Long Island. So then if we take a look at population distribution, you can see, however, that the majority of, or the larger percentages of children in this age range are from the lower Hudson Valley and Long Island. So that is where we are focusing a lot of our effort to get more providers on board and hopefully get more children into the system. So as I said, this was our original tracking measure from the beginning of NICES. But as we are now more established, we actually would like to get more than 2 shots in. You know, our goal is to actually look at children between 19 and 35 months who actually meet the benchmark, the 431, 331 benchmark, because we want kids to have a complete series in NICES, not just 2 or more shots. So now we're mapping this on a regular basis, and we're doing it by county. You can see that there's a handful in the darker color that are in the 60 to 70% range, which is around the national average. 67% is the 2009 NIS estimate of coverage. So we have a handful that are meeting the national average. And the rest of our counties, the majority of our counties, are in the 30 to 59% range. So our new goal is to really get all of our counties up to the national average of 67%, and then hopefully, grow beyond the 67 to higher percentages. So some of our technical activities. Aside from manually entering into NICES, we also, providers do electronic data exchange. So that is for providers that have an EHR or a billing system, they can send an electronic file of their immunizations to our system. We currently work with 62 EHR vendors that serve over 700 practices. And we always have new vendors that are in the process of testing a file to become active with us. We also have, over 100 practices that are using some kind of home in-house system, whether it be an EHR or a billing system. And it's interesting to look at, although we only have about a little over a quarter of our practices that are data exchanging, over half of the information that is in NICES comes from those data exchange practices. So clearly those are our larger organizations, hospitals, and bigger pediatric offices. And of course, if anyone is interested in looking for an EHR and they're wondering what vendors to use, we do have a complete list of the vendors that we are currently working with out on our website. We do data exchange with health plans, and it's not really exchange per se. It's actually health plans can provide us, they can submit a query of their the patients associated with their health plan and to NICES, and only if there is an exact match of information, we will send back histories for those patients. So that's been very helpful to health plans because they do annual HEDIS reports that they typically used to have to go into providers' offices and get that information, so now they can get it directly from NICES. We also data exchange with the citywide registry. So NICES covers all of New York State, excluding the 5 boroughs. 5 boroughs report to the New York citywide registry. So we currently receive data from the city registry. We just receive any patient that may have gotten a shot in the city, but actually has an upstate address. And we are now also reciprocating. So we hadn't been in the past, but that's just begun, where we are sending them kids who have received shots upstate but may live in the city. And with that, kind of in relation to that, we are working on an interstate data sharing agreement. And we're very close to signing it. It's been almost 5 years in the making with all the legal and policy ramifications. They finally have kind of come to an agreement, and we are working with some of our border states. So we're working with New Jersey and Pennsylvania currently to sign this agreement. So New York State and New York City have signed, and we are just waiting for New Jersey and Pennsylvania to sign. And then we will be able to share data with those 2 border states. And a lot of people always ask about some of the other states that border us, and this is kind of the beginning. Once we get an agreed upon policy that's been approved by all the legal systems, I think it'll be a smoother and a quicker effort with some of our other border states. Some other things that the data exchange folks can do, we can provide an organizational extract for someone who's newly come on with an EHR. If you have a brand new EHR and prior to that you were manually entering into NICES, instead of having to go back and double enter your information, we can provide an organizational extract to seed your new EHR with the patients you've already spent effort putting into NICES. For those people who have been working in an EHR and have all their data, we can provide an update file that will give you any changes or updates to a patient that is associated with your organization. So currently, and we've had a lot of requests for this update file, and it's not on our end. We can send the file. It's really your vendor that has to prepare something on their end to receive the file and do something with it. So we haven't had a lot of vendors that have done that yet, but we are actually working with 2 large organizations, Bassett and Rochester General, that actually are, their vendor is set up to receive this update file. So I'm sure more will follow. So other program linkages. In the 5 years since NICES has been up and running, we are now working with some other programs within the health department. The blood lead poisoning prevention program, we actually added an enhancement to our system, so we actually have blood lead reports right in NICES. So when you look up a patient, you can get their IM histories and also all their blood lead test reports. The Department of Health also has child health information integration. I think it's kind of going to become the overarching umbrella of all of the health information. And what's kind of under their purview right now is they're working to connect NICES with the Universal Public Health Node. So this is to facilitate health information exchange. And currently they're doing it with the RIOs, which are Regional Health Information Organizations. And I think there's only one RIO that's currently working on this project, and any providers that work with that RIO. And this is basically just automated data exchange. So for providers that have an EMR, they currently still have to log into NICES and manually hit a button to upload that file. This project is going to eliminate the manual process so that it becomes an automated process where it just uploads at specific times that are set. And it will send your data to NICES and you'll receive back response files. The second phase of this coming down the line in the future is that you will also be able to almost in real time do a query. Say you have a new patient, you'll be able to request that patient information and get it back directly. So that's kind of the work that's going on with the UPHN. And then the other program that we are in the process of linking with is the early hearing detection and intervention. Unlike blood lead, they will not have their own screens within NICES. We actually will just have a button that links you to the early hearing detection database. So there'll be two avenues to get to it. One will be under this new umbrella child health information integration system. You'll be able to go directly to hearing and not go into NICES if you aren't someone who needs immunizations, such as the audiologist. But if you also need to look at hearing tests and you have NICES access, you can do it directly through NICES as well. So they should be, that's our next release actually, that should be happening by the fall. And we also work with CDMS, which is a clinical data management system, I believe that stands for, and it's more for the counties. This is really just a county system that handles their pod work, pod activities. So whenever counties do, a lot of times they do flu pods, and all those immunizations that they do at a pod has to go into the CDMS system. And they are able to transfer, do a file transfer, so that we can receive that information in NICES. We only take the immunization information, and typically they use the pods for flu, but it could be any immunization. So we can do a file transfer on any immunizations that are given at these pods. For 2011 through 12, the flu season, we added from CDMS 146 children, but over 4,000 adults. So keep in mind that NICES has a public health law which makes reporting mandatory for 18 and younger. So anyone 19 and older is considered an adult would require consent. So the counties did a great job in getting all of those consents so that they could be added to NICES. And this is some work we are doing. We have some grants, new grants that we are working on. There's 3 program areas. The first one's very techy. Program area 1 is kind of in the background. It's really just to enhance interoperability between EHRs and NICES. And there's a file transfer process that's called HL7. So there's an upgrade to that they're working on. Program area 2 is really the big one for us. That one is we're going to be adding vaccine ordering to NICES. So providers will eventually go directly into NICES instead of calling for their VFC vaccine, their vaccine for children, the publicly funded vaccine. Instead of calling in their orders, they'll be able to go into NICES, place their orders, and then when the vaccine shipment comes in, it will go into inventory. So you'll be able to manage ordering and inventory all in one fell swoop. And it won't just be for manual users, it will be for manual and our data exchange users. Because currently, our manual users have access to inventory functionality, but our data exchange users do not. Because if they send us IMS, there's no way for the system to automatically decrement. But that will all change when this new ordering system is in place. So that's planned for, I think, probably mid-2013. And Program Area 4 is related directly to the county health departments, and this is a new billing process or billing system that will be in NICIS for counties to bill for immunization. So I've just seen little bits and pieces of it as they're starting to build the forms that will go into NICIS, and it's basically for counties who are going to be billing. Another project that New York is participating in is being run by the CDC. It's a 2D barcoding pilot project. So we have offered up our providers as participants to this barcoding pilot. I believe there are about 42 New York State providers that are participating. I think they're all data exchange. I think was part of the criteria that they all be data exchangers. So basically, this project is running through March of 2013. They're going to be giving the participating providers scanners and the software, and there are specific, I think there's only 2 or 3 vaccines that have this barcode that they'll be using for the pilot, and so whenever they administer those, they'll be scanning them. So this is to hopefully enhance complete and accurate reporting of these vaccines. And we've also recently applied for another barcoding grant that will kind of expand on this pilot. And we also are working with the University of Rochester on a study. They received a grant from the CDC, and it's called the Oasis Study, which is optimizing application and support of immunization systems. So basically, they're evaluating how practices use NICIS and their other electronic systems in their office to expand and enhance their immunization efforts. So this is kind of in the middle. They've sent out some surveys, and they've received about 200 responses, and there's like a phase 2 of surveys going out. So we're hoping to get a lot of good data out of this survey. Moving on to training. We are in our 5th year, so we are not as ramped up as we had been in the early days of NICIS. We were doing a significant amount of training, a lot of classroom training, but we are still training a lot of people, but we've kind of changed our focus. We're doing a lot of outreach and support, and we're focusing on compliance. We have the majority of our providers on, but there are still a group that's just digging in their heels and hanging in there. So we are trying to reach out to providers who are not active in NICIS at all, or had activated and actually took training but aren't consistently reporting. So we have sent letters, and we are following up with them. We've asked them for an action plan as to how they will get into compliance, because it is a public health law that everyone report immunizations. So we continue to work with them, provide training, or whatever else. A lot of them are in the process of getting an electronic health record. So we are working with them to get them up to speed with the rest of the providers. Part of that, because now we aren't training massive amounts of people, we have more availability to go to a practice and do on-site training. So we are offering that, that if the need be, we can come to the practice and train all the staff at one time. Although we're finding that we need to be a little more picky about where we go, only because we're finding that they don't really have a facility for training. So you're in an exam room, or you're in the reception area, and patients are coming and going, and the phones are ringing. And so I don't think there's a lot of really good learning happening with all of that. So we have to be a little stricter on our qualifications for an on-site. Another option, which I try to encourage more, would be an org-specific webinar. So we do a lot of webinars, and we can do one specifically just for one org and all of their staff, so it's more of a one-on-one. But our general training are webinars. We do 2 live webinars a month, which are open to anyone. And we have recorded webinars of all our different trainings that are really more convenient and flexible. They're available 24/7 when anyone has time to watch them. And then a supplement to our formal training are our online tutorials. So these are available. It's basically our entire system broken down into 10 or 15-minute little videos. So you can watch just specific areas. If you don't remember how to add a patient or add a user, you can watch just a video on that specific function. And then something else we've added is an Ask the Trainer webinar. We do it once a month. It's actually this Friday. It's always from 11:30 to 12:30. And it's just an open help desk forum where you can log in to the webinar, ask questions. You can see things being demoed. And so that's working out well. We found that we had to kind of come up with a specific topic to draw people in, and then from there they feel more comfortable asking other questions. And then, of course, we have our paper user manual. And this is just other outreach that we are doing. Initially, when we started up, we did not reach out to schools because obviously you need to get providers and get kids into the registry before it will be valuable to other organizations such as schools. But the schools were very proactive about reaching out to us. And so we did let them on as they asked and requested. We do have a webinar training for them. But we recently, in May, actually did a proactive blast email to all those schools that have health commerce accounts to remind them about NICES and the training. And we bumped up our users by over 200 in between May and June. So we did add a lot of schools on with that blast email. So we will probably do another outreach in the fall. Colleges and universities, we have a recorded webinar. We haven't really reached out directly to them, but we have those on that have health centers that add IMS specifically, not as many for lookup. And this is just a list of the different webinars that we do have available of different topics. The first two are kind of the core when you're new. Those are the basic training that you take, and then the others are more more customized for different training needs. And we still manage to communicate with all of our 12,000 users, either through blast email, but mostly we have an announcement section on our NICES homepage, and that's where anything that's going on with the system or anything that goes on with the vaccines, we update you on when VIS dates are updated on a vaccine, any kind of information like that always is on the announcements for the NICES homepage. And the other way we communicate with our users is through user group meetings. We have them usually it says spring and summer, but it's really spring and fall. And so we do that twice a year, and we go to every region. And, that's a good opportunity, for people to network and for people to, for us to meet our users and to discuss whatever they have questions on, to demo anything new. So they've been really helpful and useful to those who come. Although I will say, unfortunately, we just canceled the fall. This is the first time in 5 years, but we are canceling the fall user groups just because we've had a series of unforeseen things happen that have delayed all of our enhancements. So the things we were going to show them and instruct them on for the fall have kind of been delayed and won't happen in time. So instead of making everyone jump through the hoops of travel approvals and getting time out of the office to basically not see a whole lot, we thought we would hold off until we had more information to share with them. So for those who may not know some of the NICES features, obviously the core function of NICES is managing patients and immunizations. But what I have kind of learned through what I've seen in that Oasis study that Rochester is doing, that they're really educating people on some of the other functionality of NICES that a lot of people haven't had the time to investigate, and they're really not using NICES to its full potential. But there are a lot of other functions that are optional that are available to our users. So aside from managing patients and IMS, There are all sorts of reports. Ad hoc reports, I think, are the most useful. You can do count and list reports, so you could do a count of the number of people in your organization who got a flu shot in 2011. Or you can do a list if you wanted more information, patients' names, date of birth, phone number, those kinds of things. You can do a list report. And there's a lot of filter criteria, so you can filter by date of birth or vaccination date, all sorts of things, VFC eligibility, so it just depends on what you're looking for. So those reports are really good when you're looking for specialized reports. Sometimes they're a little intimidating for folks, but that's why we always highlight them at a Ask the Trainer webinar or at the user groups to kind of get people more comfortable with them. The benchmark report is a nice way. We were talking about the series, the 431, 331 series. The benchmark is a way you can see how your kids are doing overall in your practice meeting the benchmarks. A lot of people tend to run this before they have the county come in for an AFIX visit to kind of get a sense for where they're at. The assessment report is very comprehensive. It's a big report, and it kind of analyzes immunization status and coverage overall in your organization. Reminder recall, that's a valuable one to run. You can run, it will tell you what's due or overdue. You can do it by a specific vaccine. You can ask for all vaccines. So that's a great way if you're looking for a specific vaccine, certain time of year before school starts, and you want to know, who's due for what vaccines. You can run a reminder recall. We also have custom letters that you can develop to mail based on your reminder recall. And then the COCASA extract is really geared for the counties. It's an extract they can pull from NICES to help them when they go into a provider's office to do their assessment visit. So instead, in the old days, they used to have to go in and pull records and then manually enter them into COCASA, which was kind of futile because it just went to COCASA and didn't really help out. But now they can pull the extracts, see what's missing before they get there, give the practice time to put those IMs into NICES. And the Vfc report, which is known by providers as the doses administered report. This is a required report for anyone who orders VFC vaccine, has to be sent to the Vfc program monthly. If you use NICES, you do not have to fax that report to the VFC program. Once you tell them that you are fully functional in NICES, they will be able to look that up, so it saves you from faxing. And some of the other optional features, as I mentioned, we do have manage inventory, so you can manage all your vaccines, public and private, in NICES. And the nice thing is once you put that lot number and all that information is, you don't have to type it again. You'll just be clicking on it when you go to choose to add it as an IM, and it automatically decrements as you give immunizations. So it keeps track of your inventory for you. Another feature I don't know that a lot of people use, but it is an option. You can add schools, but I think more of use would be adding clinicians and physicians. So you can add your staff so that associated with the shot will be the ordering authority and who administered the shot. So once you set up your drop-down boxes, you can select those as you're giving IMs, and then that information will always be attached to those immunizations. And then, of course, managing lead, which we talked about. Most people will have a read-only view of blood lead tests unless you're a physician office laboratory that can actually add lead information. And then just because I know there's a BT slant, I thought I would mention that we did add, back in 2009 during H1N1, we added the CRA module to NICES, which is the Countermeasure and Response Administration module. And so in the event of a public health emergency, NICES can be used to track the administration of vaccine. And it was used during H1N1. So organizations would be selected to participate in the event, which all of organizations were for H1N1. So that you are able to select orgs to put into your event, and there are priority lists as well.